If you find yourself massaging your temples throughout the day or reaching for headache medication more frequently than you'd like, your jaw might be part of the problem. As we age, changes in the temporomandibular joint can sometimes contribute to tension headaches. A specific 30-second jaw exercise might help support headache relief for some older adults. Research shows that approximately 60% of adults over 65 experience regular headaches, with many suffering from them at least weekly. These headaches have become so common that many consider them an inevitable part of aging. Yet what many people don't realize is that the temporomandibular joint, or TMJ, the joint that connects your jawbone to your skull, can play a significant role in headache patterns, particularly as we age. What's especially interesting is that tension in this joint can trigger pain that radiates to the temples, forehead, and even the back of the head. Let us know where you're watching from and how old you are in the comments below. One particular jaw exercise has gained attention from specialists who study the connection between jaw function and headache patterns. This simple 30-second movement, which can be performed anywhere without special equipment, appears to be associated with reduced headache frequency and intensity in several observational studies of older adults. When pain management specialists first began investigating this exercise, many were skeptical that something so brief and simple could potentially make a meaningful difference for chronic headaches. However, as evidence accumulates, the neurophysiological mechanisms behind this approach are beginning to make scientific sense. I'm Dr. Rachel Thompson, and for over 25 years, I've studied non-pharmaceutical approaches to pain management in older adults. Today I'll share a 30-second jaw exercise that appears in multiple clinical protocols across different medical disciplines. A practice that might help support headache relief, particularly for seniors experiencing age-related changes in the temporomandibular joint. Before we explore this exercise, I'd like to ask you to subscribe to our channel and turn on the notification bell. Each week, we share evidence-based approaches to healthy aging focused on practical, accessible strategies. If you're interested in natural ways to potentially support pain management, you won't want to miss our upcoming videos. This jaw exercise is fascinating not just for its simplicity, but for how it addresses multiple factors that contribute to tension headaches in older adults. To understand why it might be effective, let's first explore the connection between your jaw and your headaches. The temporomandibular joint is one of the most complex and frequently used joints in your body. It's involved in speaking, chewing, yawning, and even subtle expressions. This joint works in coordination with numerous muscles around the face, head, and neck, creating an interconnected system where tension in one area can affect others. As we age, several changes commonly occur in this joint. The cushioning disc within the joint may thin or shift position. Arthritis might develop in the joint surfaces. The muscles that control jaw movement can develop habitual patterns of tension, especially if you clench or grind your teeth, a habit that often increases with age and stress. These age-related changes can create a pattern where the jaw muscles remain partially contracted even when at rest. This chronic tension can trigger or exacerbate headaches in two primary ways. First, the tense muscles themselves can refer pain to other areas of the head. Second, chronic jaw tension can contribute to compressed nerves and restricted blood flow that may trigger headache patterns. The masticatory muscles, those used for chewing, are particularly powerful and can exert significant force when tense. The temporalis muscle, which spans from the jaw up along the side of the head to the temple area, is often a key player in tension headaches. When this muscle remains contracted, it not only creates local jaw discomfort, but can directly cause pain in the temple region, a common location for tension headaches. Additionally, the pterygoid muscles, which lie deeper inside the jaw structure, can refer pain to the sinuses, the area behind the eyes, and even the neck when they harbor trigger points. These referred pain patterns explain why what feels like a sinus headache or neck-related headache might actually originate from tension in the jaw muscles. What's particularly concerning is that many conventional headache treatments don't address this underlying jaw tension. Pain medications might temporarily mask the symptoms without resolving the muscular component. This might explain why some seniors find their headaches returning despite medication. The 30-second jaw exercise I'm about to share has been incorporated into treatments by neurologists, dentists specializing in TMJ disorders, and pain management specialists. What's consistent across these disciplines is recognition of the exercise's potential to release tension in the jaw muscles and promote healthier joint function. The basic jaw relaxation exercise. This exercise focuses on consciously releasing tension from the jaw muscles while promoting proper alignment of the temporomandibular joint. The movement is subtle but potentially powerful when performed correctly and consistently. Begin by sitting comfortably in an upright position, whether in a chair or on the edge of your bed. Allow your shoulders to relax and take a few deep, calming breaths. It's helpful to perform this exercise in front of a mirror initially to ensure proper technique. Place the tip of your tongue gently against the roof of your mouth, just behind your upper front teeth. This tongue position naturally discourages clenching and promotes proper jaw alignment. In many traditional relaxation practices, this tongue posture is considered a natural position that helps align the jaw and relax the associated muscles. Now, allow your teeth to separate slightly so they're not touching, while keeping your lips gently closed. This creates what specialists call the resting position of the jaw, where the muscles can truly relax and the joint is properly aligned. In this position, there should be a small space between your upper and lower teeth, approximately the width of a pencil eraser. With your jaw in this relaxed position, place your fingers gently on the joint itself, which you can locate by opening and closing your mouth slightly while touching the area in front of your ears. You should feel the movement of the joint under your fingertips. This tactile feedback helps you become more aware of how your joint moves, and whether it's moving symmetrically on both sides. The active component of the exercise involves making very small, controlled opening movements of the jaw while maintaining the tongue position against the roof of your mouth. Open your mouth only about half an inch, much less than a normal opening, and then slowly close back to the resting position without allowing your teeth to touch. The key here is the small, controlled nature of the movement. By limiting the opening to just half an inch, you're working within what therapists call the pain-free range, a zone where the movement can help mobilize the joint and relax the muscles without triggering protective muscle guarding or pain responses. Repeat this small opening and closing movement slowly 5 to 6 times over approximately 30 seconds, focusing on keeping the movement smooth, symmetrical, and pain-free. The goal is not to stretch or strengthen the jaw, but rather to retrain the muscles to release excessive tension and function more harmoniously. Margaret, a 76-year-old who had struggled with frequent tension headaches for years, incorporated this jaw exercise into her daily routine. "I was having headaches 3 or 4 times a week, always reaching for pain relievers," she explains. "After practicing this simple jaw exercise regularly for about 3 weeks, I noticed my headaches became less frequent and less intense when they did occur. I still get them occasionally, but they're much more manageable now." What surprised Margaret most was discovering how much tension she had been holding in her jaw without realizing it. "When I first tried the exercise, I was shocked at how difficult it was to truly relax those muscles. It made me aware that I was clenching my teeth throughout the day, especially when concentrating or stressed. This awareness alone has been valuable. Now I catch myself starting to clench and can consciously relax my jaw." Margaret also noted improvements in areas she hadn't expected. "I've noticed that my neck feels less tense as well, and I'm sleeping better. I hadn't connected those issues to my jaw tension before, but it makes sense that they're all related. It's remarkable how addressing one area can have such widespread effects." The implementation approach. The most effective implementation of this exercise involves performing it multiple times throughout the day, particularly during periods when headaches are most likely to develop. Traditional approaches recommend practicing it at least 3 times daily, morning, midday, and evening. Many specialists suggest setting specific trigger points throughout your daily routine to help remember the exercise. For example, you might practice it each morning right after brushing your teeth, at midday before lunch, and in the evening while watching television. Linking the exercise to existing habits helps establish consistency. What makes this approach particularly accessible for seniors is that it can be performed anywhere, while reading, watching television, or even sitting in a doctor's waiting room. No special equipment is needed, and the subtle nature of the movement means it can be done discreetly in public settings if needed. Some practitioners recommend using small colored dot stickers placed on items you see regularly throughout your day. Perhaps on your bathroom mirror, refrigerator, or reading glasses case. These visual cues serve as reminders to perform the quick exercise, helping to establish the habit until it becomes more automatic. William, a 79-year-old with chronic tension headaches that often interfered with his daily activities, found a consistent approach particularly helpful. My doctor suggested I set a recurring alarm on my phone to remind me to do the exercise several times throughout the day, he shares. That structure helped me develop consistency, which seems to be key. Within about a month, I noticed my headaches were less severe, and I was using fewer pain relievers. What William found most valuable was how this approach gave him a proactive tool for managing his headaches. Before learning this exercise, I felt helpless against my headaches, just waiting for them to strike and then reacting with medication. Now I have something I can actively do to potentially prevent them from developing or getting severe. That sense of control has been significant for my overall well-being. William also appreciated how the exercise helped him become more attuned to his body's signals. I've learned to recognize early warning signs of tension building in my jaw, which often precede a headache. Now I can intervene with the exercise before the headache fully develops, which sometimes prevents it altogether. That early intervention seems to be especially effective. Let us know where you're watching from and how old you are in the comments below. While the basic jaw relaxation exercise provides a good foundation, there are several variations that might address specific jaw-related issues that commonly affect older adults. These targeted modifications might be worth considering depending on your particular situation. Variations for specific concerns. For those experiencing significant jaw clicking or popping, a modified version emphasizes jaw alignment during the exercise. Place your index fingers on your TMJs, in front of your ears, and your thumbs under your chin. As you perform the small opening and closing movements, use your fingers to provide very gentle guidance, helping your jaw move in a straight vertical path without deviating to either side. This alignment focus variation can be particularly beneficial for seniors with arthritis in the TMJ, or those who've developed asymmetrical jaw movements over time. The gentle guidance helps reinforce proper tracking of the joint, which might reduce irritation that contributes to headaches. For individuals with more severe jaw tension, or those who clench during sleep, some specialists recommend adding a gentle stretch component after the basic exercise. After completing the standard 5 to 6 repetitions of small jaw movements, place your fist under your chin and open your mouth against this very gentle resistance. Hold for 5 to 10 seconds, then slowly release. This additional component might help address deeper muscle tension. For those whose headaches seem particularly related to stress, incorporating a breathing component can enhance the exercise's effectiveness. Inhale slowly through your nose as you slightly open your jaw, and exhale through slightly pursed lips as you close to the resting position. This coordinated breathing pattern may help activate the parasympathetic nervous system, potentially reducing overall tension. James, a 74-year-old with both tension headaches and diagnosed TMJ arthritis, found the alignment focus variation particularly helpful. My dentist had pointed out that my jaw was shifting to one side when I opened my mouth, which was likely aggravating my joint, he explains. The modified exercise with finger guidance helped me become aware of this pattern and gradually correct it. As my jaw movement became more symmetrical, my headaches actually decreased in frequency. What James appreciated most was how this approach addressed the underlying mechanical issue, rather than just treating symptoms. At my age, I've learned to look for root causes rather than quick fixes. This exercise seems to address why my headaches were happening in the first place, which makes more sense to me than just taking more medications. James also found that the exercise helped with other symptoms he hadn't initially connected to his jaw. I used to get this strange ear fullness and occasional dizziness that I thought was completely unrelated to my headaches. My doctor explained that the TMJ is very close to the ear structures, and tension there can affect those areas too. As my jaw function improved with the exercises, those ear symptoms decreased as well. The neurophysiological mechanisms behind this exercise's potential effectiveness are multifaceted. First, the conscious relaxation of the jaw muscles may help reduce myofascial trigger points, hypersensitive areas in muscle tissue that can refer pain to other regions of the head. By regularly releasing this tension, the exercise might help interrupt pain referral patterns. Second, proper positioning of the jaw joint may help reduce pressure on the structures surrounding the TMJ, including nerves and blood vessels that can trigger headaches when compressed. By promoting proper joint alignment, the exercise potentially creates more space for these sensitive structures. Third, the rhythmic nature of the exercise might help reset proprioception, your body's sense of position and movement, in the jaw. As we age, this positional awareness can become less accurate, leading to suboptimal jaw positioning. Regular practice of controlled movements may help recalibrate this system. Now, I want to share what might be the most important factor for success with this approach, something that specialists consistently emphasize. The key factor appears to be consistency and awareness. Unlike medication that can provide rapid symptom relief, this exercise works through gradual neuromuscular re-education, essentially teaching your jaw muscles a new pattern of function. This learning process requires regular repetition over time before significant changes occur. Many people report noticing subtle improvements within the first week, but the more substantial benefits typically develop after 3 to 4 weeks of consistent practice. This timeline aligns with what we understand about neuromuscular retraining, which involves creating new movement patterns through repeated practice. Equally important is developing increased awareness of jaw tension throughout your day. Many seniors are surprised to discover how often they clench their teeth during concentration, stress, or even while watching television. The exercise helps increase your sensitivity to this tension, allowing you to consciously release it before it escalates to headache-producing levels. Elizabeth, an 83-year-old who incorporated this jaw exercise into her headache management approach, noted how it increased her overall body awareness. "I never realized how much tension I carried in my jaw until I started practicing this exercise," she shares. "Now I notice when I'm starting to clench, not just in my jaw but in my shoulders and other areas too. I've become more tuned into my body's stress signals, which helps me address tension before it turns into a headache." Elizabeth also found the exercise beneficial during headache episodes. "When I feel a headache coming on, I immediately do the jaw exercise. Sometimes it can help reduce the severity before it fully develops. It doesn't always prevent the headache completely, but it often makes it more manageable without having to take as much medication." For those who want to try this jaw exercise, I recommend starting today and committing to practicing it 3 times daily for at least 4 weeks. Be patient with the process and remember that the benefits typically develop gradually as your neuromuscular system adapts to new patterns. It's worth noting that while this exercise is generally gentle and safe for most people, it's always wise to consult with your healthcare provider if you experience significant jaw pain, limited jaw movement, or severe headaches. These could indicate conditions that require specific medical attention beyond self-care exercises. Let's summarize the 30-second jaw exercise that may help reduce headaches for seniors. Sit comfortably in an upright position, and take a few deep breaths to relax. Place the tip of your tongue against the roof of your mouth, just behind your upper front teeth. Allow your teeth to separate slightly while keeping your lips gently closed, creating the jaw's resting position. With your fingers on your jaw joints, in front of your ears, make very small, controlled opening movements of about ½ an inch. Perform 5 to 6 slow repetitions over approximately 30 seconds, focusing on smooth, symmetrical movement. Practice this exercise at least 3 times daily, particularly in the morning, midday, and evening. Consider variations that address specific jaw issues like clicking, severe tension, or stress-related clenching. This simple practice, when performed consistently over time, appears to be associated with reduced frequency and intensity of tension headaches in many older adults, particularly those with TMJ-related tension. While no single approach works for everyone, this jaw exercise represents a gentle, non-pharmaceutical option that might help support headache management as you age. The beauty of this approach lies in its simplicity and accessibility. It requires no special equipment, can be performed anywhere, and addresses a potential contributor to headaches that is often overlooked. If you found this information valuable, Please consider sharing this video with friends and family who might benefit. Many people struggle with headaches as they age, unaware that jaw tension might be contributing to their discomfort. Subscribe to our channel for more evidence-based approaches to healthy aging, and tap the notification bell so you never miss an upload. Each week, we explore different aspects of well-being for older adults, always focused on practical, accessible strategies. Thank you for joining me today. I wish you comfort and well-being in the days ahead. Until next time, take good care of yourself.